8 disturbing predictions for the future of healthcare. The new vision for healthcare, which will be implemented soon and continue beyond that year, will emphasize access, quality, cost, and predictive, preventative, and outcome-based care models that promote social and financial inclusion. We are on the cusp of entering a new decade marked by global change. The years will serve as a reality check for long overdue national healthcare policy and regulatory reforms that need revitalizing future strategies. As China works toward its goal of having the best and cheapest health system in the world, the country will continue to close its gap with the United States on critical health measures. Let's start with 8 disturbing predictions made for the future of healthcare. 1. Virtual reality causing an obesity epidemic. Virtual reality will become an excellent tool for making healthcare more pleasurable in the future because it has the potential to make the healthcare journey for patients more agreeable. By providing an entirely immersive experience, it alleviates all different types of pain, dissipates fear, and offers more empathy and better care. On the other hand, what if the first line of affordable VR devices that deliver immersive experiences that are way better than reality leads to a wave of addiction in the future? This would be similar to what happens with online gaming. Even though we have no scientific evidence that VR has any side effects in low doses, there are already works of fiction that depict scenes where excessive use and careless humans might be taken by technology. This is even though there is no scientific evidence that VR has any side effects in low doses. The predicament of choosing between living online and IRL and the romantic repercussions of either choice are depicted graphically in the short science fiction film Uncanny Valley. Furthermore, the Disney cartoon WALL-E shows what happens to fitness humans who become addicted to virtual reality. 2. Bioprinted human organ transplants take place on the black market. Even back in 2014, Organovo was able to effectively bioprint liver tissues. 4 to 6 years would pass before they could print liver sections for transplantation. The business believes solid printing organs such as the kidney, liver, and heart will be possible over the next 10 years. The FDA may approve the bioprinted liver tissue in 2019. While technological progress happens quickly, legislative development moves at a snail's pace. It is not out of the question, although it should be avoided, that the regulatory framework surrounding the use of human organs that have been printed would fall behind this crucial advance. Hundreds of thousands worldwide are on the waiting list for an organ donation. In the not-too-distant future, the first transplantation of a printed human organ could occur through the use of the black market because no ethical bureau will be courageous or well-equipped enough to supervise it. 3. Editing genes with CRISPR at home. In October 2017, biohacker Josiah Zahner gave a talk in San Francisco in which he claimed to be the first person to have edited their DNA using the CRISPR-Cas9 technology. He is adamant that anyone can use one of the gene engineering kits his company manufactures. The prospect of something so scary and fraught with peril fills you with dread. 4. Ultimately, healthy humans will ask for technology body extensions. Memory enhancement via brain implants is a possibility for the future. Magnets or RFID chips could replace passwords and keys surgically put in our fingers. Exoskeletons have the potential to enhance not only our strengths, but also a wide variety of other human capacities. Enhancing human bodies with the assistance of machines will become increasingly common as technical advancements in medicine and healthcare continue to increase. It improves our speed and strength and heightens our awareness of our surroundings. The first transhumanist will urge medical professionals to replace a conventional arm with a robotic one. What kind of response would that get from the medical community? We are delighted that this information continues to pique your curiosity. We encourage you to remain tuned for further details. We tried to compile all of this one-of-a-kind research, and we would greatly appreciate it if you hit the like button and subscribe to our channel. 5. Interoperability by pure-play solution vendors gains ground against standalone systems. Regarding government regulations, vendor acceptance, and strategic focus by healthcare IT buyers, we predict that interoperability will progress significantly in 2020. Standalone solutions that do not support data mobility will face severe competition or failure to secure funding. To restart the trend toward personal health records over enterprise health data, the U.S. government will take considerable action shortly to compel the sector to enable interoperability of inpatient medical records. Interoperability solutions will be in high demand in the European region as forward-thinking health systems in the European Union intend to accomplish EU eHealth Action Plan 2012-2020 goals, including cross-border patient data transfers and the General Data Protection Regulation. Most growing nations in continents like Asia and Africa are frequently called data-rich but information-poor. 6. Annuity-based model to catapult gene therapy commercialization. The launch of uniQure's gene therapy Glybera generated a lot of excitement. However, the product's high price, low demand, and absence of a sustainable reimbursement model — reimbursement was only available in Germany and Italy — led to a below-average performance, which resulted in the company's simultaneous withdrawal. Attempts are being made worldwide to experiment with different payment models, such as those based on outcomes, reinsurance, income, or dynamic pricing. Despite these efforts, the widespread implementation of these payment models has been hampered by issues such as improper monitoring, the long-term therapeutic impact of treatments, and the involvement of multiple insurance payers. The commercialization potential of gene therapies will be unlocked by the sustainability of the annuity-based reimbursement model, which will result in revenue of $2 billion by the end of 2020. 7. Telehealth will become commonplace in healthcare and grow beyond chronic illnesses. By the end of the year 2020, forward-thinking healthcare systems will begin to regard telehealth as an alternative to standard care for primary care virtual consultations. Within 2 to 3 years, full regulatory approval and clinician support for telehealth will be achieved. The most difficult challenges facing the healthcare system in the years to come may be overcome through telemedicine, which will also make it possible to give care in a manner that is more efficient financially. The prognosis has dramatically improved since the reimbursement door was opened for telehealth services in these significant countries. The landscape is shifting due to various projects carried out in the most recent months. We predict that healthcare payers in the United States will provide patients with additional out-of-network treatment options. In contrast, China wants to cover 70% of the country's public hospitals with a telemedicine program funded by the government by 2022. The potential for telehealth will expand during the next 2 to 5 years due to the introduction of 5G wireless technologies, additional capabilities that extend outside the home. 8. Precision medicine-led approaches will pave the way for next-gen health data analytics solutions. Precision medicine will finally reach the clinic in the next 10 years thanks to cognitive analytics systems that can combine genomic, clinical, and lifestyle data to produce useful clinical insights. By the end of 2020, the precision medicine informatics services market is expected to reach $5 billion. A SaaS-based cognitive insight platform for precision medicine with the needed multimodality interoperability and security functionality, which are in an intertwined ecosystem of payers, providers, and pharma, and these will gain market traction. As large health systems transition to value-based care, they must work with multiple analytics partners for thorough patient data analysis at an enterprise level. As a result, both plug-in application providers and vendors with integrated analytics solutions are tied to popular EHR or PHM platforms, and these are expected to gain market acceptance. In 2020, there will be significant growth potential for businesses that provide tools and infrastructure for managing real-world data and real-world evidence. Well, now that the topic is ended, you must have got to know these various healthcare disturbing predictions. If you liked the video, please hit the like button and subscribe to our channel for further updates. Tell us how it went, and if you have any suggestions, please include them. We are interested in hearing what you expect from our content.